Canada's healthcare system is cracking. It's buckling under the weight of a critical doctor shortage. This isn't a new problem. We've been warned for years. Yet here we are. Millions of Canadians are struggling to find a family doctor. Emergency rooms are overflowing. Wait times for specialists are outrageous. This is our reality, a system in crisis. This shortage isn't just inconvenient, it's dangerous. Without access to regular care, small health issues become big ones. Preventable illnesses become life-threatening. It's a domino effect, putting immense pressure on our hospitals and healthcare workers. The system is overloaded, patients are suffering, and the people who dedicate their lives to caring for us are burning out. The stories are heartbreaking. A young mother in rural Manitoba drives hours for basic prenatal care. An elderly man in Nova Scotia waits months for a specialist appointment, his condition worsening by the day. These are not isolated incidents. This is the human cost of inaction. This is the reality of a healthcare system stretched to its breaking point. The statistics paint a grim picture. The Canadian Medical Association estimates that over 5 million Canadians lack access to a family doctor. Wait times for specialists can stretch for months and even years. Rural communities are hit particularly hard, with limited access to even basic healthcare services. These numbers tell a story of neglect, of a system failing to meet the needs of its people. This crisis didn't happen overnight. It's the result of years of neglect and underfunding by successive governments. They ignored the warning signs. They failed to invest in training enough doctors. They turned a blind eye to the growing needs of an aging population. Now we're paying the price. The reasons for this shortage are complex, but one thing is clear. Our leaders failed to plan for the future. They didn't invest in medical schools, leading to a bottleneck of qualified applicants. They made it difficult for foreign-trained doctors to practice here, depriving our system of much-needed expertise. They ignored the pleas of healthcare workers who saw this crisis coming. This isn't just about numbers. It's about priorities. It's about a government that has consistently chosen to prioritize other things over the health and well-being of its citizens. It's about a lack of political will to address a problem that has been allowed to fester for far too long. The consequences of this neglect are now impossible to ignore. We are facing a critical shortage of doctors, nurses, and other healthcare professionals. This shortage is impacting every aspect of our healthcare system, from primary care to specialized treatment. The system is overwhelmed, and patients are bearing the brunt of this crisis. The human cost of this doctor shortage is immeasurable. It's measured in lives lost, in illnesses that could have been prevented, in the stress and anxiety of not knowing where to turn for help. It's a crisis that affects us all, directly or indirectly. Elderly patient media. Elderly patient sitting alone in a waiting room, senior citizen looking through a list of doctors. Imagine being a senior citizen with a chronic condition, unable to find a doctor who will take you on as a patient. Imagine being a young parent forced to wait hours in a crowded emergency room with a sick child. Imagine being a healthcare worker, burned out and demoralized by the impossible demands of a system in crisis. This is the reality for millions of Canadians. The doctor shortage is not just a statistic, it's a human tragedy. It's a crisis that is eroding our trust in the healthcare system and undermining our faith in the government's ability to provide for its citizens. The economic cost is staggering. Longer wait times lead to lost productivity. Untreated illnesses become chronic, requiring more expensive care down the line. The strain on our healthcare system is unsustainable, both in human and financial terms. We are mortgaging our future by failing to invest in the present. Section 4. The false promise of privatization. Some argue that the solution to this crisis lies in privatization.
They claim that introducing private healthcare options will shorten wait times and improve access to care. This is a dangerous and misleading argument.
Privatization is not the answer. It's a recipe for further inequality and suffering.
Private healthcare would create a two-tiered system, where those who can afford it receive faster and better care, while those who can't are left behind. It would siphon much-needed resources away from the public system, exacerbating the existing inequalities.
It would turn healthcare into a commodity, accessible only to the wealthy.
The evidence from other countries is clear. Privatization leads to higher costs, worse health outcomes, and greater inequality. It undermines the principles of universality and accessibility that are the very foundation of our healthcare system.
We cannot let this happen in Canada.
We must reject the siren song of privatization and instead fight for a stronger, more equitable public healthcare system. A system that puts people before profits. A system that ensures that everyone, regardless of their income or postal code, has access to the care they need.
A system that values its healthcare workers and provides them with the resources they need to do their jobs. Section 5, Saskatchewan's Legacy, a Warning. The history of healthcare in Canada is a story of hard-won victories.
We must remember the legacy of Tommy Douglas and the CCF government in Saskatchewan, who fought tirelessly to establish universal healthcare in this country. They understood that healthcare is a right, not a privilege.
The Saskatchewan model, which later became the blueprint for Canada's Medicare system, was founded on the principle of universality. It was a system designed to ensure that everyone, regardless of their ability to pay, had access to quality healthcare.
This principle is now under threat. The push for privatization is a direct assault on the legacy of Tommy Douglas and the countless others who fought for a more just and equitable healthcare system. It's a betrayal of the values that have made Canada a beacon of hope for so many around the world.
We must not let their sacrifices be in vain.
We must honor their legacy by fighting to protect and strengthen our public healthcare system. We must stand up against privatization and demand better from our elected officials. The future of healthcare in Canada depends on it.
Section 6, a call to action reclaiming our health. The doctor shortage is a crisis, but it's not insurmountable.
We can fix this, but it requires a fundamental shift in our thinking. We need to stop treating healthcare as an expense and start seeing it as an investment. An investment in our people, our future, our country.
We need to invest in training more doctors and nurses.
We need to make it easier for foreign-trained medical professionals to practice in Canada. We need to improve working conditions for healthcare workers and address the burnout crisis.
We need to increase funding for medical schools and research. This requires a multi-pronged approach.
We need to increase funding for healthcare, ensuring that our system has the resources to meet the needs of a growing and aging population. We need to address the root causes of health inequities, ensuring that everyone has access to the same quality of care, regardless of their income or postal code.
We need to listen to healthcare workers who are on the front lines of this crisis.
They are the ones who see the impact of the doctor shortage every day. They are the ones who know what needs to be done to fix it. We need to empower them to be part of the solution.
This is a defining moment for Canada.
We can choose to continue down the path of neglect and privatization, or we can choose to invest in a stronger, more equitable public healthcare system. The choice is ours. The time to act is now.
Let's reclaim our health. Let's rebuild our healthcare system. Let's ensure that everyone in Canada has access to the quality healthcare they deserve.